Hello, my name is Jeanette Cadell, and I'm in course NU 713, and this is my X-treme Makeover PowerPoint. Table of contents, introduction and learning outcomes. Upon completion of this PowerPoint, the listener will learn about a time of miscommunication at one of my previous employments, how the possible miscommunication occurred, organizations as a conversation at this particular employment, patterns of relating and how they can incorporate them in the organizations for innovation. Also, patterns of meaning to incorporate in their organization for innovation, and learn ways of talking, being, and listening, and how to incorporate those into the organization for innovation as well. So this is a miscommunication that occurred at a workplace that I was employed with. I worked in a long-term care facility where the facility received daily admissions. The facility would admit patients for long-term, short-term, and respite care. Respite care usually entails a very short stay. The family provides all clothing, medications, and everything else is provided by the facility. The administrator usually receives the patient admission paperwork and is reviewed by a registered nurse to ensure appropriateness for the facility. Respite care patients must have a home visit from an RN. This particular day, I was the RN to review respite paperwork. After reviewing the paperwork, I informed the administrator that the patient appeared appropriate for the facility and would perform the home visit during lunchtime. I arrived at the patient's home, performed the interview with the patient and his parents, and reported back to work. I assembled a meeting with the administrator, director of nursing, social worker, and the restorative nurse. In the meeting, the team was informed that the patient was not appropriate for the facility due to the patient having autism and having the mind of a 2-year-old, and further informed the team that the patient has separation anxiety and would get physical abusive with anyone in his path if the parents left him alone. The family informed the writer on one occasion they left their son with a family member, and the patient badly abused the family member, and the family member had to be admitted to the hospital. The writer further implied with the patient's history, the staff and other patients may be put in danger. Everyone on the team agreed except for the administrator. The administrator voiced, "Our census is low and we need patients, so we will take this patient." And this is the end of this meeting. The administrator has to review referrals with the medical director and discuss the RN's recommendations. The review was done between the administrator and the medical director declined the referral. So in this communication, I felt like the administrator may have been frustrated because of the low census. And usually if they have low census, they have to cut staff, which we were already short staffed and working overtime. And on one occasion, she voiced that one of the particular RNs she had to fire because she couldn't trust her judgment and assessment skills when it came to doing performing assessments on home visits, and then also inconsistency on appropriateness for the skilled facility stay. So some chats during lunchtime, conversational themes. We talk about a various of things when I was at this facility. Of course, I was at this facility during the COVID time. I was there 3 years prior to COVID. Staffing shortages. With that, staffing shortages were a problem prior to COVID, and it got worse after COVID. If you were working and your relief called in for that day, you were mandated to stay at work. No ifs, ands, or buts about it. Administration would not call anybody else to see if they wanted to work. It was mandated that you stay. You had to stay. There was no policy and procedure as far as, okay, if it's you today, the next nurse will stay tomorrow. If it happened again, if it was on your cart, so to speak, you had to stay to work. Increased patient loads at this particular facility. We would have on a given day anywhere from 20 to 25 patients. This is day and evening shift, and on nights they would have as many as 40 patients apiece. We got no incentives or raises. You once you started, that's what you stayed at your rate, your pay rate once you became a employee. Mandatory overtime, like I said, if it was your day to stay, if someone called in on your cart, then you had to stay over. Also, we talked about seeking other employments. I actually left after the facility got stable with COVID. I left due to the staffing shortage and just being overworked. Culture of organization based on conversations. We were tired, just basically burned out. We had a lot of nurses just to leave nursing altogether. We were underpaid. Like I said, we got no raises or incentives, and we weren't appreciated. We never got a thank you or anything. Even during COVID times, like the administrative staff never, just praised us or thanked us for being, the excellent staff that we were, taking care of these patients. Organization as conversation. Patterns of meaning. These are specific things that exist in an organization, and a pattern of relating on how people interact with each other. So with the patterns of relating, these can be face-to-face meetings, emails, and bulletins. When I did staff development at this facility, I would always try to hold a monthly staff meeting, so that way they could know what was going on during these meetings in the facility. And a lot of times during these meetings, the administrator would, if the staff had any kind of comments or anything, she would shut the meeting down and say that's the end of the meeting. Never let the employees voice their opinions. Patterns of meaning. This is their vision statements, mission statements, values, guiding principles. And their mission statement was to provide the utmost care to patients and provide passionate care, and in hoping that patients could return back to their home outside of the facility. Ways of talking, body language, eye contact, consistency, and tone. Anytime you're talking to someone, you always want to maintain eye contact. A lot of times, some of the administrative staff will walk through the nursing home and wouldn't say a word to any of the employees. No good morning, no nothing, just walk past them. Wouldn't even make eye contact, would hold their head down so they wouldn't have to speak to you. And a lot of times, like I said, during the staff meetings, the administrator would be so ugly, and some of the staff would just plain walk out because of the demeanor that the administrator had. Ways of listening, communication, nonverbal communication, verbal cues and verbal cues, facial expressions, eye contact, hand movements, and speaking. In this, you always, like I said, want to maintain eye contact. Your facial expressions tells a lot about the way your tone is. If your face is all balled up and you're trying to talk to your staff, they're not going to be receptive to what you're saying. They're just gonna ignore what you're talking about. Or even if with speaking and your tone is ugly, they're not gonna be receptive to what you're saying. Ways of being, living in the now and present interactions with human beings. Like I said, at this particular facility, I felt like, and also the staff felt like, the administrator was the main problem. Like I said, she would walk past you, wouldn't say good morning, how you doing, is it anything I can help you to do, even though she was an RN. But she did none of those things. And a lot of the staff members voiced to me when I was in the staff development position, they did not like her. And that was sad to say. And I think that demeanor reflected upon the care that they gave the residents. And the attitude that they gave. Some of the residents would complain about how the staff, they were kind of not really ugly, but dry. So if you're not getting treated right in the administration role, then that means that's going to rub off on you and not want to make you be the best employee that you can be. Innovation. So both and thinking may assist in creating innovation. Current leaders should have different skills from previous leaders. You should want to bring something fresh to the table instead of trying to build upon what someone else has built. Build upon that in addition to bringing something else to the table. In It's always good to be curious. If you have a curious mind, that means you have new innovations within you. So we want to change the story of with innovation. So in this particular facility, I think they need to rebuild their administrative staff. We need to reinforce the organization missions and values. Also, positive working environment. Walk to the staff and say, they should walk up to administrate everybody. It should be just, your job should be, you should be comfortable at your job. You should not have to go to work worrying about if someone is going to be ugly or not speak to you. Like I said, the positive working environment, positive communication. Patterns of relating. Like I said, the face-to-face meetings were good. It's just how they always ended as far as administration goes. One-on-one conversations. I would have a lot of one-on-one conversations with staff just to see where their mindset was. And they had some good ideas, and a lot of times I would bring these ideas to administration and they would shut them down. So I think that if we could get someone at this particular facility that cared about their employees as well as the patients, it would be a different environment, and innovation could take place. Meanings of patterns of meeting, upholding the mission statement and values. I think, like I said, with the change of administration, I think things would be better as far as if with the mission is being upheld. However, if your staff is not happy with the way things are going, then that's a problem. Ways of being giving the staff praise for their work. I would try to give goodie bags and stuff out during the staff meetings. I would give them gift cards and show compassion to your staff. Ways of talking: have a positive body language during the conversations. Keep the eye contact. Show them that you're interested in talking to them, and use the appropriate tones. As far as the same goes with ways of listening. Like I said, that positive tone, positive attitude, all of that goes a long way when dealing with your staff. So rewriting the story. I worked in a long-term care facility where the facility received daily admissions. The facility would admit patients for long-term, short-term, and respite care. Respite care usually entails a very short stay. The family provides all clothing, medications, and everything else is provided by the facility. The administrator usually receives the patient's admission paperwork and reviewed by an RN. To ensure appropriateness for the facility, respite care patients must have a home visit from the RN. This particular day, I was the RN to review respite paperwork. After reviewing the paperwork, I informed the administrator that the patient appeared appropriate for the facility and would perform the home visit during lunchtime. I arrived at the patient's home, performed the interview with the patient and his parents, and reported back to work. Once back at the facility, I spoke with the administrator and made her aware of the interview. A meeting was assembled with the administrator, director of nursing, social worker, and restorative nurse. In the meeting, the team was informed that the patient was not appropriate for the facility due to the patient having autism and the mind of a 2-year-old, and further informed the team that the patient has separation anxiety and would get physical abusive with anyone in his path if the parents left him. The family informed the writer on one occasion they left their son with a family member, and the patient badly abused the family member, and the family member had to be admitted to the hospital. The writer further implied that the patient's history, the staff and other patients would be in danger. The administrator voiced, "We do not need this type of patient at our facility at this time due to us not being able to provide adequate care for them." Further stated, "I thank the team and staff for all you do to provide care for our patients. I will inform the medical director of the findings." These are the references. Thank you.